Good morning, everyone. Welcome to office hours today. I'm glad that you were able to join us. We had a great learning community yesterday. I'm sorry if you were unable to see that. We are going to have that videotaped, so we'll have more information for you. I'm just gonna make sure we have everyone muted at this point. And today we're gonna focus on nursing quality, advancing nursing practice, and how that aligns with our HIN measures. So it's going to be pretty exciting, I think, and I'm looking forward to all of you helping with giving feedback, asking questions today. So we like to know kind of who's in the room. If you want to just let us know your name, what your role is, what facility you're in, you can type it into the chat box. Just as a reminder, take a moment to mute your phone to eliminate any background noise that there might be during today's presentation. Also, if you have dialed in, don't place your phone on hold because sometimes we get the music in the background. And again, I'm looking forward to good, healthy discussion today with our presentation. So I want to spend a little bit of time on our objectives today to recognize nursing's role in quality initiatives. We're going to have the ability to recite professional role competence, and then identify nursing performance goals related to our HIN measures. So when we think about developing quality competence, we kind of have to start at the core. And that is with identifying what your organizational needs are. How do you do that? Well, you start with the mission and values. That obviously we all know that's what defines our organizational needs. And then what our strategic plan is all about. Take a look at that. How does that strategic plan drive your nursing processes? I want to spend a little bit of time thinking about, do we have a nursing philosophy? You just sort of need to evaluate what it is. And if you don't have one, you want to start to focus on should you have one. And here's the reason you want to answer yes to this question. Nursing approaches really need to start with your philosophy. Some examples of that would include expectations for nursing, nursing roles, nursing interactions, nursing ethics. The philosophy really needs to reflect what our thoughts are on what we believe to be true about the nursing profession. Investigating nursing theories that can provide foundations for philosophy development is very helpful. And I was thinking about how do we start that, and I have a couple ideas on that. Watson's philosophy and science of caring is one adult-focused nursing philosophy. It's a good one. I like it. The other one I was thinking of was Pender's health promotion model, another philosophy that is very focused on adult nursing. When you start to think about this philosophy and the development, where you want to start is engagement of your nurses. So when you're meeting with your nurses, you want to say, hey, does this align with our strategic plan? Then evaluate with the nurses. Do you want to have an actual nursing departmental strategic plan as well? And they go hand in hand. And the ticket here is just remember that they all have to be in alignment and cohesive. You do not want to actually have any concerns with problems where they're not in alignment, excuse me. When we think about developing our plan, I think I missed a slide. Hold on here. There we go. So when we're talking about our organizational needs and engaging nurses, those engagement models, they would truly give that employee meaning. And I think we all know that because we've been there, done that. And we all know from the quality realm that when you get the doers involved, you get the best products, the best outcomes. And that's when you get true active engagement. So incorporating engagement models, we want to make sure we're thinking about that patient and family-centeredness, that we're looking at what those interdisciplinary standards of practice are, and that we have nursing clinicians who actually have an active voice. We know this, but when we're engaging nursing at all levels, we get the best information because we have that firsthand knowledge of what the struggles are that they're facing. It's where we can get some true innovation with their ideas and asking them for their help. And when you're engaging the nurses, we know through our processes that we're doing some evaluation to identify those champions, the people who can really be truly utilized. They're the ones that are going to help us, who want to learn more about what our initiatives are, what our measures are. They want to assure that we have evidence-based practice in place and looking for those models and what works best for best practices. And they're the ones that are going to help us with that training, whether it's formal or informal training with nurses at all levels. I think sometimes we forget that we as people, and nurses are no different, and many of us on the line are nurses, we want to have rewarding challenges, and we want to gain knowledge in our practice, and we want to and expect to be lifelong learners. And I think about where we get engagement. And I had a situation when I was a manager where we had nursing meetings. And when I was new to that particular unit, the nursing meetings were only for the registered nurses. So I wanted to develop all nurses as leaders on my unit. And so I changed this RN meeting to a nurse meeting. That included the LPNs as well. We started working on leadership and what leadership meant and how that looked on our unit. What was interesting was it was the LPNs who had the most direct contact and were giving that moment-by-moment direction to the subordinate staff, whether they were the patient care techs, the nursing aides. They were the ones that were able to share what they knew, and they were the ones who felt like they were learning the most and able to take that out to the employees, and that we were unified in our approaches when we started working on that and working in those models together. So that's an example of making sure you have the right people involved and nurses at all levels. Next, I want to kind of speak a little bit about where we get started when we're developing our standards of clinical nursing practice and how that aligns with our quality. But we already know that the standards of clinical practice, there's a framework, it's called the nursing process, and we're very aware of it, most of us. And so you can see that here on this slide. So that kind of is our foundation. That's where we start when we're working forward in our clinical practice framework. And then next will come our hospital-identified nursing model, or what framework it is, which will be driven by our nursing philosophy. One of the things is I wanted to give some examples of some different frameworks and models. You can go to the American Nurses Association, and they have some different books that guide us. One is the Nursing Scope and Standards of Practice. That's pretty essential. It's currently in the second edition. I don't think there's a third one out yet, and that is a 2010 dated. There's also, keeping in mind, if you're looking at specialty nursing scope and standards, those are important if it's related to something specific. Then there's the academic and professional development models, and you can take a look at those. If you haven't read the book by Benner, she's got her model of novice to expert, and that one really makes sense to me. I have shared that with nurses in the past, and it is like an eye-opener for them on their role in quality, their role in helping their peers, and in their own self-growth and professional growth. Additionally, there's some other items that provide modeling standards. We oftentimes have many requirements, regulations. There's credentialing and privileging requirements, as well as that statutory and regulatory language. So you can get a lot of that information, obviously, from the Board of Nursing and within the Works for Iowa. It's also important to keep in mind that we want to utilize models that have evidence-based policies and procedures. And some sources might include the American Nurses Association. They have a 2014 professional role competence position statement, which is kind of a cool tool. Sometimes it's a nice way to even just get started. So as we're talking a bit about nursing competence, that starts when we take a look at really what nursing quality is. So take a look at that bottom left on there. We know that through our knowledge, our skills, and our attitude that we can develop that competence. And what's competence all about? It's about performing, obviously, successfully and at that expected level. And competency is expected level of performance that integrates that knowledge, skills, abilities, and the judgment of the nurse. And the ability to perform at the expected level or competence requires that process of lifelong learning. This is a nice slide to utilize and incorporate into some of your nursing meetings or other meetings where you're leading quality initiatives with nurses. Registered nurses must continually assess what their competencies are. They have to identify what their own needs are for additional knowledge, skills, personal and professional growth, and integrative learning experiences. And I think as leaders in quality, as leaders in nursing, we are the ones that can help with giving that direction to our nurses. So we have a lot of opportunity here to help with the evolution of nursing competence. And then we spoke a little bit earlier about nurse involvement being essential to any significant healthcare improvement initiative. And as you take a look at this slide, what comes to my mind is to ask yourself, as well as asking the nurses, are we following the 6 specific dimensions of healthcare? That is from the IOM Institute of Medicine's updated report. You know, is it safe? Are we avoiding injuries to patients from the care that's intended to help them? And are we being effective? Providing services based on scientific evidence to all who could benefit, and if there's some refraining from providing services to those who are not likely to benefit. So here I'm thinking when we're being effective, we're avoiding underuse and that overuse and kind of leaning things up as we've talked about so many times. And then are we ensuring the safety through patient and family-centeredness? Are we giving that care that is respectful, that is responsive to the individual patient preferences, their needs, and what their values are? And are we ensuring that the patient and the family is truly engaged in those clinical decisions? This is where our bedside rounding and our huddles are so important for our patients and families. And are we being timely? So, you know, when you think about being timely, are we reducing what the wait times are, the potentially harmful delays, the things that are happening when we're giving care, what the expectations are for the patients and giving care? And are we being efficient? Are we avoiding what the wastes are, whether it's administrative waste or it's operational waste? We think oftentimes about waste being equipment, you know, overstocking of supplies. We don't always think about our human resources, and are we really using our nursing time to focus on the quality pieces and the patient-centeredness? And then being equitable. Are we providing care that doesn't vary in quality because of the person's characteristics, age, gender, geographic location, socioeconomic status? And those are things that we want the nurses to be aware of and that they're thinking about in their care that they're providing. So when we are working on establishing some different nursing goals. We want nurses at all levels to truly serve as leaders in all of our quality efforts. So we want to make sure we're engaging them and we're empowering them to actually act as leaders. And then we want to make sure that the care designs that we're developing optimize the nurses' professional expertise and what their knowledge is. We need to enable the nurses to practice to the fullest extent of their license. And we need to provide learning opportunities so that they can do that. And then I'm thinking about engaging nurses again at all levels in developing and executing initiatives. You know, are they truly engaged? Are they a part of the quality piece in deciding what's important for nursing? Do they understand why we have a priority in our quality works? And then nurses, as we know, work with all members of the healthcare team to ensure that we have that safe and reliable care. And so in thinking about that, the agency standards and expectations really need to align with that interdisciplinary team, what those processes are, how those goals are set, and that they're doing that as a team. And to optimize team performance through initiatives designed to improve communication, creating that shared understanding of the patient and family condition. That's how we work on that team performance. And then we want to build a safety culture where trust abounds. And the culture of safety is so important to our patient safety. In a just culture, where learning is encouraged around all the safety events that might occur within our hospitals, that it's not a punitive environment, that it's truly open, and it's non-punitive in culture, where reporting results because they're doing the right thing and they know they won't get in trouble, and you can make those improvements. And then I think about the structures and processes to ensure patient and family-centeredness. We need to make sure that we're getting that input and engagement from the nurses to keep those structures simple, the processes simple and standardized, and to visualize information and lesson. Keep things visual is where I'm going with that. Take photographs of things. Lessen the demand of memory and recall. When you've got a bundle process and you're using that in the emergency department, post it, laminate it, keep it accessible, keep things very visual. And I think it's important to get the input of the people in the work area on what's going to be the most helpful for them to keep it visual. And then we have to think about establishing these nursing goals and the learning systems to assure nurses have access to quality outcomes and supportive, innovative care delivery. So we want to make sure we're utilizing research, that we're using the best practices, staying evidence-based in our care delivery. And sometimes this is a little bit of a rub for some nurses, and it's a training opportunity as well. When I think about this and getting things moving forward, I think about the HIN toolkit and Innovation membership and how that provides such a forum for the inquiry, the discovery, and the sharing for nurses. If your nursing leaders aren't currently aware of the HIN toolkit, if they're not aware of the HIN measures, the time is now. Engage them in innovation. Your improvement advisor can help with showing what the resources are, the tools, and how networking can be an improvement in the nursing outcomes. I want to just also talk a little bit about HIN goals and the understanding why. When I think about the relationship that our HIN goals have to mission, vision, and strategic planning, they often overlay with your hospital organizational goals, your vision, your mission, your strategic plan, what's happening within nursing and the philosophy of the nursing at the unit level, as well as the institutional level. And we want to take a look at the HIN goals being high risk, high volume. Are they? Are these the ones you want to focus on in your facility? Your improvement advisor gives you input and consults with you on some different areas that they recommend where you can work. And what impacts are there to patients and outcomes when we're thinking about the HIN goals and getting ready to move forward within nursing? And as we know, having measurable goals is the most important. So maybe you could write your nursing quality goals to align within your organization's strategic plan that encompass what your employees are doing, having them involved. And do your employees really know what your agency goals are? Do they know what the Compass HIN goals are? And do they understand how they align? What is that alignment? Helping them understand the why. Once we provide that to the nurses to aid their understanding of the why, it's the first and the easiest step to get organizational buy-in from your nursing, whether it's nursing leadership or nursing nurses on the floor. We know it's important when we're writing nursing quality goals to use SMART goals. And when we've probably all seen this infographic about SMART goals, and we know that the S is for specific. And it's really about what's the goal going to accomplish and how and why it's going to be accomplished, and then being measurable. How are you going to measure whether or not the goal has been reached? It's kind of important to list at least 2 of the indicators. Have 2 areas that you can know through measuring that the goal has been reached. And we'll talk about that as we talk about some of the HIN measures and goals. And then achievability, obviously. Is it possible? Have others done it before? Has it been successful? Do you have the knowledge, skills, and abilities and resources to even accomplish the goal that you're trying to set for the nurse? Will you be meeting the goal challenge, or will you be defeating it? So thinking about the achievability, making sure it truly is. And when you have the nurses involved in it, they'll help you know if it's achievable or not. And then if it's results focused or relevant, what's the reason, the purpose or benefit of accomplishing what those goals are, and thinking about what are the results. It's not the activities that lead up to the results, but it's actually what is the result of the true goal. And then being time bound, obviously I'm all about time limits and like to know target dates. So what is the established completion date? And what does the completion date create? Does it create some sense of urgency? Are there some areas that you need to move forward in quickly? Is it a 3-month target? Can it be a 12-month target? So now we're going to kind of move into talking through some of our HIN measures and then trying to use some SMART goals and to make those goals so they're actionable. And this is where I'm hoping that we might get some questions and some feedback, because when I've been out and working with hospitals and quality personnel and nursing leaders, they often say, how do you write a goal that's going to really have impact? And so, and that it's measurable, that it's truly a SMART goal. So I'm going to start with kind of taking a look at the first sample is going to be the adverse drug event rate. And when we think about the actual rate, there's some different pieces that we need to think about, because do the nurses have impact on what the rate of adverse drug events are? Well, yes they do, because you can make it specific to the individual nurse. Let's say Nurse Betty had 4 medication errors last year. Okay, well, now we want to maybe make her goal for Nurse Betty that you're going to have less than 3 medication errors in a 12-month period. But then adding into that some of the evidence-based strategies that we use within our HIN. So an example is then in the second bullet, to have 3 medication errors or less in a 12-month period, all which will be a category D or less in the NECMRP scale index. So I think that's a great goal. It can make a big difference for Nancy to go from 4 to 3. So the number is really kind of one of those that you want to negotiate on. You want to have that nurse input and why it's important, because it's a part of our adverse drug event. And you can go through those HIN measures and talk about where we're at with those adverse drug events. And then another example is maybe the nurse will have no medication administration errors that result in increased patient monitoring. Well, that's a pretty easy one to monitor, and the nurse is going to be able to give you feedback on any errors. You probably have an incident reporting system where you can pull that data. And another area is to challenge your nurses. We talked a bit about getting active with innovation. They need to know about it. And maybe you could say that they'll participate in a monthly medication error, the community of practice with our medication safety. They'll do that maybe 3 times in the next 6 months. Since we offer those monthly, those are measurable pieces that you can also use for a nice specific, well, a SMART goal. Then here on this one, I want to talk a little bit about how you can get your nurses involved in writing and developing some of the HIN goals that they might want to use. Maybe you've identified within your hospital that central line insertion compliance is an area that you need to focus on and work on. So some suggestions are just break out into teams. Have the teams, if you have 1 or 2 or 2 or 3 teams, you have each team identify 2 to 3 different goals. And then you come back together and you have sharing time. And just evaluate, what are those commonalities? How does that look? Are there some things that are high priority for your facility that you want your nurses to focus on and make those true goals? So I have put together, with our HIN measures, some nursing goal examples. I'm going to go ahead and place this on Innovation for you just to take a look at. You can share this with your nursing leaders, and it'll just at least be a baseline of a place to get started. But after we're talking today about developing that philosophy for nursing, moving through with that engagement, trying to develop those nursing goals that are SMART, what are some takeaways that you have today with what we've talked about thus far? I know we only have a 30-minute period and we have about just a few minutes left. So I'm hopeful that today you found to be interesting and entertaining. Just keep in mind, are your HIN goals SMART? We're very willing to work with your nurses, with your nursing leadership in developing HIN goals, working through what the SMART goals are. Please just place any comments in our chat. We have a lot of information that we want to share about nursing goals. I'm going to take the next few minutes just to give some reminders. The 123 Equity Pledge is the campaign to eliminate healthcare disparities. And the question is, has your facility taken that pledge? I think we had less than 30 Iowa hospitals that were engaged in that pledge. So we want you to look at that a little bit closer, take some time to explore it. We are very willing to help you with learning more about that as well. The 2017 Iowa Healthcare Collaborative Annual Conference is available for registration. When we post these slides, you can click and register and view the brochure. It's also on Innovation. Office hours is always the last Wednesday of every month at 11 o'clock. And next month, we're going to do an introduction to candor. So that'll be exciting. We're going to spend some time focusing on candor. Our next fall prevention COP it's always the third Tuesday of every month at 11. And I am the leader for that. If you ever have questions, you can reach out to your improvement advisor or to me. Every admissions and care transitions COP is the fourth Tuesday of every month. Kate Carpenter leads that. And hospital-acquired infections COP is the first Tuesday of the month, and Erin Fielmeyer does lead that. Join the discussion with us on Innovation. Get your nursing leaders involved. We're very excited to help you work toward your nursing quality goals. Here we are, your HIN team. Reach out anytime. I want to thank everybody for today, spending time with us, hopefully helping you, and please let us know what we can do to help. Thank you and have a good day.